Hi, everybody. This is Dr. Mary Gardner with Lap of Love, and this Facebook Live is about something that could make you want to pull your hair out, and that is if your dog or cat is up all night, panting and pacing, and maybe keeping you guys up all night. And it is something that so many people struggle with, and even me myself. I've had two animals, both a dog and a cat, that would keep me up at night, and it was so frustrating. First for me because I wanted to sleep, but it was also, really it made me nervous, like what was going on with them, and I was concerned if they were comfortable or if they were going through some anxiety. So I wanted to dedicate this Facebook Live to talk about that panting, pacing, howling, meowing, difficult to just settle down pet, and what some of the causes may be and what some of the things that we could do for it. So first off, I do want you to know, and I've already mentioned this, that it's frustrating, and know that you are not alone. So this can be a challenge to figure out what it is and a challenge to manage. And sometimes we actually just can't. But let's talk about some of the reasons why they may be circling and panting and drooling and doing all these crazy things. First is they might actually have some kind of pain or discomfort. So many animals have arthritis. That's probably the number one reason many have pain as they get older, just like you and I are going to. So they may have some arthritis that makes it uncomfortable for them to sleep long, or they toss and turn. And so it's really important to first and most important is to find out what the underlying cause is. So go see your veterinarian. They can actually evaluate all of the joints. They may need to do some x-rays just to see how they are and see if there's something that we could do to help with their pain. Sadly, so many cats have arthritis and nobody realizes it because we don't really bring our cats out for walks like we do for dogs, right? And so, and they just kind of lie around in the sun, or in a sunbeam, if you will. But they have so much, there's so many incidences of arthritis if we just looked at them under an x-ray, and they just don't complain as much. So it is really important to make sure our kitty cats go see their veterinarian. And unfortunately, I think it's maybe 30% of cats go see, especially as they get older. It's really crazy statistics on how often that the kitty cats are seen. So underlying causes like arthritis, some other painful causes could be even a type of bone cancer could be painful, maybe even some organ discomfort like pancreatitis or irritable bowel disease or gastric reflux. So we want to see if they have some pain that's keeping them up at night, just like if you were up at night. And you might just complain to your spouse, well, these guys are panting and pacing because they want, they want you to kind of help them out. The next reason is anxiety. So they may have a disease that's making them anxious. The most common one that will make them, well, there's two that I think of that will make them anxious. First is any disease that prevents them from breathing well. So laryngeal paralysis is a huge one, and I had that with one of my dogs until he had surgery. And that is they just can't get, they just can't feel comfortable to lay down because they're struggling to breathe. Another is heart failure, and again, I had a dog with heart failure, and they can't lay down, so then they shift a lot. Another might be cancer that has spread to the lungs. So anything that prevents them from breathing well, I get very worried about, and they also might have some difficulty just sleeping through the night. Now, another big disease that people just don't know dogs and cats get, and it's cognitive dysfunction. It is just like or very similar to dementia in humans, and it's a huge epidemic in humans and also in our dogs and cats. So 50% of dogs over the age of 10 have some form of cognitive dysfunction. So it's called canine cognitive dysfunction, and our felines get it too. So this one's tough. This one's really hard because it is similar, like I said, to dementia, and how to just keep them calm. Now, what's interesting is a lot of times it's throughout the day, they may be fine, but as soon as twilight hits, there's something called like sundowner syndrome in humans. Well, it happens also with pets, whereas it starts to get a little dusk, they can't see as well. That may also add to their cognitive dysfunction, and so they get a little bit more anxious, and especially at night when things go dark or the things settle down. And I have had some clients that it's all night. long that they're up and panting and pacing, and it's just because of this dementia-like experience that they're going through. So I already mentioned seeing your veterinarian, and that is really important because they could make sure that there's not underlying pain or disease that we first want to manage. Now, something else that I also want to encourage you asking your vet about is to take a urine sample to see if they have a urinary tract infection, because just like pain with arthritis, pain from a UTI, a urinary tract infection, could actually make them exhibit these signs more. So get a UTI check for that, and also check for blood pressure, because high blood pressure can cause these issues. So always go to make sure that these things we can handle these. And then there's some environmental changes that you can try at home. So your veterinarian may prescribe some medications, and I have prescribed everything from gabapentin to melatonin to anapril to even some like doggy Xanax. And it has worked wonders in many cases. And in other cases, we need to try other types of medications. It's just like you and I. One thing may work and one thing may not work. So we may have to try different things to get them through the night. I had this one wonderful dog named Nevada out in California, and it ended up just being very high doses of Xanax to make sure that she could sleep through the night. So your veterinarian needs to make sure that they give you the proper doses of any of these medications, and you don't want to mix them. I see many Facebook groups out there with pet owners are desperate for help, and they're talking to each other about what the doses are. It's really important that you get the correct dose for your pet, for what the symptoms that they're going through, and making sure that their kidneys and liver can handle it. So some environmental changes is maybe some night lights. I know this may sound a little odd. However, some of these pets have decreased vision and they can't see as well at night, and maybe they need to get to their litter box or out to their water bowl or something like that. So there's wonderful night lights out there that go on when there's motion nearby. So run over to Home Depot and get some. They sell them all over Amazon as well. Soothing background noises. I bought for my boy, it was a sound machine, and listen, not Siri, but what's her name? Alexa. Alexa could do this for you, and just play some soothing sounds when you're gone or at night. And we talk about nighttime panting and pacing and things like that, but they may be doing it during the day, but you're not home. So you don't know how much that they're doing these things, especially when they're alone. So you could even put a little camera up there to check them out. But Alexa can help you out with some soothing sounds. And there's also on YouTube some species-specific music and videos that you can play, which may help. But you also need to get sleep, so we want to make sure that it doesn't sound distracting to you. Another product that I'll recommend is the Thunder Shirt. So that you can get online. It's called Thunder Shirt, and it's just a gentle compression type of shirt that they could wear, and that sometimes is what they need. There are pheromone sprays available. Siva makes some. There are essential oils and oil diffusers. I mean, if you've ever gone to get a massage or a facial and you walk in and it smells so good, it does calm you down. So the same thing. Another easy thing to do is have a really big playtime before bed. So at 10:30 at night, a half hour of playtime, whatever that is, or a really good walk. So let them out. Sometimes we have to also hold back some of their water or food, but then also sometimes we actually need to give them food before they go to bed. So I had one client that it was giving food before they went to bed that actually was helpful, kind of slept through the night. So it is very pet dependent. So, but going for a walk, a nice good walk, just kind of, gets them relaxed. The next thing is people ask me all the time, should I give them a warm bed or a cold bed? Well, the answer is give them both and see what they want, because we may think that they want warm beds, but they actually want cooling beds. And so I actually have something called an Uller on my bed, and it keeps my bed very cold because I like that. So there are different products out there that you could use to give them the option of what they want. So many pets will go on a cold tile floor, except for then they have a hard time getting up from it, but that just feels better to them. So providing those options is really good. Another thing to have is a fan. So just not like a huge fan, but just a normal fan on low, because there are nerves. This is really helpful for those dogs, that have respiratory issues, so laryngeal paralysis, for example, because there's a nerve called the trigeminal nerve that there are receptors in your nose, and when air passes by those receptors, it actually relaxes them so they don't feel that as much anxiety because of respiration issues. So it doesn't need to be cold or hot air, it just needs to be air blowing past them. So if you have any dog that's got that respiratory issues or maybe panting or pacing so much, just put a fan nearby their bed or somewhere in the house where they can go to. So not only does it can cool them down, but just that air passing by their receptors is helpful. And then acupressure is also really good. So if you have a veterinary acupuncturist near you, or maybe a mobile one, they can actually teach you some relaxing points. So there's one on the forehead, and I have kind of a very reactive dog, meaning when he sees other dogs, he goes a little bonkers. And so there's a point that I'm always pressing on him to help calm him down. So your veterinarian acupuncturist could actually teach you some acupressure points. So like I said, it is definitely something that so many people struggle with. I myself had a cat that every night, wow, and wow, all night long. And so I know that some of you may have that as well. He did end up having a UTI, but he still had cognitive dysfunction. So when I treated his UTI, that decreased a little bit, but it was hard. And sometimes the best medicine of all is actually you. And so inviting them into your bedroom, because sometimes they may not normally sleep in your bedroom, but sleeping with you or hearing your breathing may actually help them. So there are some people that have to get like baby bumpers for their beds. That way they don't, so if a dog has some concerns that they may fall out of the bed, they can be a little safer. But there was also a study that showed that the scent that lit the pleasure centers of a dog's brain most is the scent of their owner. So if you also take a shirt or something that smells like you and put it in their, in their area, maybe in their little cubby if they're a kitty cat or the dog or something like that, even when you go away for the day or at night, that may be a little bit extra to help them. But this is such a really distressing thing for everybody. So just to recap, check for pain or diseases that may be causing this. So go see your veterinarian. And then it may also be anxiety or things like cognitive dysfunction. That's really tough. So your veterinarian can prescribe some medications that will help your pet sleep. Listen, sometimes it's even getting 4 hours of sleep that'll make them feel better and make you feel better, or maybe even through the night. So hopefully I gave you some tips. Know that you are not alone. And it can be frustrating. So just do your best to make it through the night yourself. So that soothing music may be good for you as well. So I hope this was helpful. And there's a lot of different Facebook groups out there that the communities can give a lot of good advice and tips. And so I encourage you guys, if you found something that was helpful for you and your pet, to put it in the comments. So till next time, take care of your gray muzzles. Bye.